jackknifed, forcing that road to close so crews could clear the crash. And then intermittent closures tonight in Provo Canyon for avalanche control. The winter weather also forcing US 89 to shut down at the Utah-Idaho border.
In Wyoming, Interstates 80 and 25 also forced to close because of poor visibility and slick roads. Look at this, the dash cam video from the Highway Patrol showing a van nearly hitting the trooper. You see it right there. That trooper responding to another crash. Luckily, he managed to get out of the van's path, a very close call, and a reminder for drivers to slow down, especially when roads are so slick out there.
Ooh, that video gets the nerves going. All right, let's head right over for a first look at the forecast.
Chief Meteorologist Alana Brophy tracking all the latest details for us tonight. Alana.
Hi, friends. We're not done with the valley rain and mountain snow. It's also snowing in our mountain valleys. Live look at Cache Valley, where it continues to come down. We did see some rain this afternoon, but temperatures have dropped in the Logan area, which is why accumulating snow is back and continues to stack up. This is a live look at I-80 in Evanston, and you can see snow-covered roads on the interstate. Not a surprise. We did see winds gusting, so blowing snow, reducing visibility in that area. Now, it is rain on the valley floor in Salt Lake and Tooele counties, but we still have snow out there, and that's impacting our mountains. Winter storm warning in effect for the Wasatch, Uintas, Bear River Valley, as well as southwestern Wyoming. That holds until tomorrow evening. We also have the winter weather advisory, which you see in purple. That includes the backside of the Wasatch, Cache Valley, Summit County, and central Utah. That holds through the overnight, and you looked at that live camera, and you can tell exactly why. We are not done just yet. Temperatures did make it into the 40s in Salt Lake and Provo, which is why we were dealing with valley rain. Upper 30s in Logan for that period of rain, but now temperatures have dropped in those areas. 30s and 40s for the highs. In eastern Utah, we hit 50 in St. George. Taking a look at the temperatures right now, we're at freezing in Logan, 30s along the Wasatch Front, but above the freezing point, and will stay there in many of our valleys. But we know our mountain valleys not quite as lucky with those colder temperatures. You can see that moisture on the satellite radar keeping things active in the northern half of the state. As we zoom in, you can see valley rain in around Ogden through Farmington into Salt Lake County, and the snow holds on through Cache Valley towards Evanston and in Summit County. We are not finished, and this will continue through the overnight. As a result, travel will be impacted through noon tomorrow, where you see in red here. This is the Udot Impacts, giving you an idea that mountain routes, including Parley's, Sardine Summit, and Logan Canyon, are going to be messy. Plan accordingly for that morning commute. We're going to look at how much snow has fallen just yet and when our next storm rolls through. Coming up in my full forecast in just a few moments. Glenn, Emily, over to you.
All right, thank you, Alana. In our coronavirus coverage tonight, the state of Utah reporting another record-breaking high number of new COVID cases, more than 7,200 cases today alone. ABC4's
Courtney Johns has more on what health officials are saying about the surge and the impact the Omicron variant is having on our health system. She's live in studio with the details tonight. Courtney.
Yeah, Glenn, before today, the highest daily case count in Utah was on December 30th, with just over 4,700 people testing positive. Looking at today, we're at 2,500 more today. But if we're strictly looking at positive cases, the better indicator is that 7-day average, which is also high. The good news is there are several reports that suggest Omicron, which officials believe is making up a majority of these cases, appears to be more mild. The bad news, it's spreading so much faster than what we've seen with other variants.
Even with a milder disease, if you have a very large portion of the population infected, we're going to still have a lot of hospitalizations. And as I think many people know, our hospitals have been overwhelmed for 4 months.
Okay, so here is what state epidemiologist Dr. Leisha Nolan is talking about. ICU availability. There's a difference between available beds and having enough employees to take care of the people in the beds. Now, the Utah Department of Health says anything over 85% capacity, that's 85% of ICU beds full, overwhelms the hospital system. That's the red line that you see right there. The green line is the percentage of all people, not just people with COVID, currently in those ICU beds. Now, we know there's a lot of data out there, and depending on who you talk to, you'll get a different answer on what these numbers give the best info on. But Dr. Nolan says both case and hospitalization trends are helpful, but for very different reasons.
I think the case count gives us a trend, but the hospital tells us what the real impact in our society is.
Right now, just under 500 people are in the hospital with COVID-19. And another piece of data we hear a lot about is positivity rate. Right now, it's at about 23% in the state of Utah, but that data can also be deceiving because of all those at-home test kits people are taking are not included in this data, which is why the health department encourages people to do that traditional PCR test when possible.